How accurate is sputum smear microscopy for TB? Imagine trying to catch a sneaky bug that hides deep inside your lungs. That's what doctors do when they test for tuberculosis using sputum smear microscopy. It's a common method, but like any test, it has its strengths and limits. The main thing to know is that its ability to correctly identify those with tuberculosis varies quite a bit. In some settings, it detects about 30 out of every 100 true cases, while in others, it catches up to 90 out of 100. On average, it's around 75% accurate. That means it can miss about a quarter of real tuberculosis cases, which is why a negative result doesn't always mean you're free of the disease. The accuracy depends on several factors. First is sensitivity, which is how good the test is at finding true positives. Sensitivity can be as low as 30% in some places, especially where sample collection or lab techniques aren't optimal. But with better sample collection, like taking multiple sputum samples over different days, sensitivity improves. Usually, 3 samples are recommended, including an early morning one, to increase the chances of detecting the bacteria. The second factor is specificity, which measures how well the test avoids false positives. Sputum smear microscopy has very high specificity, close to 99%, so if it says you have tuberculosis, it's very likely correct. However, it can sometimes mistake other non-tuberculosis mycobacteria for the tuberculosis bacteria, which can lead to confusion. The quality of the sample and the skill of the lab technicians are crucial. Better preparation and newer microscopy methods like lead fluorescence microscopy have improved detection rates compared to older techniques. While molecular tests like expert tuberculosis can detect the bacteria with higher sensitivity and faster results, they are more expensive and requiring specialized equipment. That's why sputum smear microscopy remains a key tool in many countries, especially where resources are limited. It's affordable, simple, and effective at confirming many cases, but it's not perfect. A negative smear doesn't rule out tuberculosis, so doctors often recommend additional tests like cultures or molecular assays for confirmation. Interestingly, doing sputum tests on the same day, called front-loaded microscopy, has been shown to be just as accurate as spreading the tests out over several days. This approach can help patients start treatment sooner and reduce dropout rates. Overall, sputum smear microscopy is a highly specific test that provides valuable information, but its moderate sensitivity means it's best used alongside other diagnostic methods. Proper sample collection, multiple specimens, and improved lab techniques can make it more reliable. If you or someone you know is being tested for tuberculosis, it's important to remember that a negative result doesn't always mean no disease, and consulting healthcare professionals for further testing is always the best step.